This is Mayegun Live. Thank you so much for joining me from wherever you are tuning in. Remember, you must read beyond the caption of the broadcast. Read the description of the broadcast as well. Like it. Hear it. Invite your friends. Invite your not so friendly friends. Tell them that Mayegun today, Mayegun is live. And I am here again with some collection of goodies. And again, if the time permits us, right, we shall take calls. I actually have the intention of taking calls this evening. So hopefully, yeah, we would have that chance. All right. So ladies and gentlemen, there seems to be a good fake news from that contraption. Good in the sense that, you know, everyone or whoever hears that British citizens, American citizens are now traveling to Nigeria for medical treatment. It will sound good, right? According to the Minister of Health, Pate, his name is Pate, he said, they are these arrangements which the African Union kind of like orchestrated, and it is on earth to start with, right? That the African countries, some African countries, they have come together to improve their healthcare and get rated. So from the rates, from this African Union rating, they have rated Nigeria high to the point that people from the neighboring countries around Nigeria and across Africa, they are now traveling down to Nigeria for medical care, including those of you who are British or Americans, and Americans, okay, or Americans rather, because I don't think you can be both. Can you? I'm just saying, well, you can. Anyway, you can. So Pate, in his, widely publicized statement, he said, and I'm going to quote, okay? He said, one moment, I'm trying to kind of, he said, you can see that gradually, piece by piece, we have been building our health infrastructure, but also at a higher level in the teaching hospital. People are now beginning to come to Nigeria from the region to receive quality healthcare. This is already happening, including people from faraway places like the United Kingdom and the United States of America. Nigeria Minister of Health. I know he's lying. Sure you get. And this is not trying to say to badmouth them, okay? But somehow, I wouldn't mind if those of you living in Nigeria, at least if you have improved health care, for example, listen, nobody should know better than those of you living in that country. From Abuja to Akwa Ibom, from Akwa Ibom down to Ibadan. Ladies and gentlemen, last week, just this past week, there was this report online. It's quite heart-shattering, like heartbreaking, by the way. They said that the UCH Ibadan, you know UCH Ibadan, is a teaching hospital, right? UCH Ibadan has no running water, and to make the matter worse, for over 3 months now, they say UCH Ibadan no get electricity. That's an hospital, a teaching hospital. A premier hospital. The hospital that historically, right, was rated as one of the best hospitals in the, okay, that's a long time, in the 60s and 70s. In fact, there is an history of the king of Saudi Arabia, right, used to actually he used to come to Nigeria, right, for his medical care. True story. No, true story. Okay, this is not like the India versus Nigeria football match. Okay, 99-0. No. This is true story. All right. But that was way, 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 way back. Talking about 60 years ago, 50 years ago, before everything kind of became what it is today. 3 straight months, if you are in Ibadan, are you aware of this? Let me ask those who are here. Hopefully some of you, listen, did you know about that? Is the Minister of Health aware that there has been no power in the UCH Ibadan, the premier hospital, a tertiary teaching hospital? They have no electricity, no power for months. So, which of the hospitals in Nigeria can you, I'm talking about public hospitals now, okay, because I know, I mean, you do have private hospitals that, even though they are inadequate, like when I say inadequate, they're not like many to serve the populace or the population, okay? So you must have some money to be able to even access the private ones, okay? But if the Minister of Health is talking about improved health care, the citizens, right? The citizens should be the one to say, I live in the UK, for example, and because I am from Nigeria, okay? So ordinarily, when you meet the Brits, the British, or the early birds in the UK, they will tell you that the NHS, there are people like us, as like we are so grateful, right? We are so grateful too. I and my family, we are so grateful for this country having NHS. So now I and others can say, oh, the NHS is this or that. You know, NHS in the UK right now, you have to wait for hours. I've experienced that. All right. And then others will tell you that it used to be really, really good. The ambulance service, this and that. Here you get now. But because we have it here, I can point out the, what do you call it? The shortcomings. All right. So I can tell you, people will tell you that not the service, but not the treatment, the healthcare itself. It is the complaint about waiting. Okay. So if you are not in an emergency, right, in this country, they will ask you to wait. But you're going to see the doctor. You're going to see the best doctor for whatever it is that you are suffering from health-wise, right? So that is called healthcare system, okay, for the citizens. So, and this is public. You get that now? Like NHS is public. There are private healthcare in this country as well, like, rich people who they don't use NHS per se. Not all of them though, right? Because NHS is the best. Now, you as a person living in Nigeria, watching me right now, I want you to be able to say the same thing. Do you understand what I'm trying to say here now? That it's like, I'm not painting the picture of a very perfect healthcare or healthcare system, rather, like the system around it, okay? I'm not painting a picture of it's so perfect. No. I have people in this country, right, that are on some serious life-saving medications, right, for life, and it's free. Do you understand? Like, they don't pay a dime. And we have, what do you call it? We have people in this country as well, all of us in this country, right? Doesn't even matter whether you are a resident, whether you are a citizen or what have you. If you have any medical emergency, right, you will still be treated. So in Nigeria, if you want to kind of have to compare, you get what I mean now? Because most of the time, the Ronukus, the Ronu Nazis, they want you to pretend that you have a working country when you don't. So if a minister says, what is it called? Triage. Okay, thank you. Anyway, so the point I'm trying to make here is this. It's about the system, all right? A system where you can say, listen, we have, for example, the National Hospital in Abuja, right? National Hospital Abuja. I don't know how many beds you have there, but I'm very sure it is not up to 500 beds. Is it? So now let's use that Abuja, the federal capital. Okay, and then LUTH, Lagos State University Teaching Hospital, I think, right? In Lagos. And EXUTH, right? Ekiti State University Teaching Hospital. These are supposed tertiary hospitals, okay? So if you are watching me from any part of Nigeria right now, you are supposed to be the people to say, oh, my ego is true. Ah, man, when I went to what is that one called? The one in Shagamu and the medical center in Shagamu, and another one in Abeokuta, Federal Medical Center. Is that what you call them? The tertiary hospital in Abeokuta owned by the federal government, okay, the national government. So you tell me, I'm reading my comments so that it doesn't sound as like I'm a radio that is just talking without, Osu, God bless you. There's Osu in Shagam. There's Osu, I think there's another Osu in Abeokuta. Now, listen, right? Apart from the poor equipment, like the medical facilities that these centers are suffering from, okay? You have the problem of understaffing, right? Which is the brain drain that Nigeria has suffered, especially in the medical field, right? So you tell me, as somebody who lives in Nigeria, watching me right now on Facebook or wherever, you should be able, you should be able to say, listen, it's true, Mayegu. When I got to Federal Medical Center, Abeokuta, I couldn't believe my eyes, okay? Everything is there, and you know what I mean, like the access to that healthcare. To start with that, yeah, electricity alone they cannot provide. Tony Musogo, Ayepe General Hospital. Do you even know what that place look like? Abi you won't come to Dogbolu General Hospital to show you Dogbolu General Hospital, Papa. They are glorified mortuaries. Nigerian medical centers are places that if you go to for maybe migraine, you may come out of that place with diarrhea and like you can come out with something even worse, right? So the point I'm trying to make here is this: Tifnumbu and his gang, they have crafted the idea of feeding propaganda into the system. And to them, right, they do not have to prove anything per se. In fact, if they want to show to you that they are working, they can bring painters, carpenters, and they can begin to paint the wall of your general hospital. So when you go inside, is when you are going to realize that, what the heck, man? So if somebody in America, okay, again, listen, Nigeria is a big country, okay? So you who lives in the UK, be honest that you have once or twice traveled to Nigeria for medical treatment. it can't be really that scarce. Yeah? It shouldn't be really that. You can find one person or two people who can say, oh, it's true, Omayegu. I know they use American medical system anymore. Where Nigeria did. There should be real evidence. If those of you who are living inside Nigeria, who knows the truth, can come out and say, it is true, Omayegu. Let's be honest, this renewed hope, we now have access to medical care. Mayegun, you need to come and check it. Or Mayegun, I will make a video for you tomorrow and send it to you. They have done it. Sure, you get now. So me, I will just be like, oh, that's good then. Because that's one thing about doing the right thing, okay? That people don't like you, won't matter. You understand? Like, oh, it's because you don't like us. Or it's because you don't like him. That's why you can't see. Because that's what some of them will say to you. They will tell you that you cannot see how the good things that Tifnumbu is doing. Like they told us that we couldn't see the good things that Bokwari was doing because we hated him. That's what they said. And today, Tifnumbu and his gang, they are saying that they are trying to fix Nigeria that Bokwari destroyed. Yes, Tifnumbu's appointees have said that. The same people who said Bokwari was laying foundation. Now they are saying that no, Stephen will be the bricklayer who is now laying the foundation for a better future. So what did the Bokwari do in 8 years? They said they took Nigeria back 50 years. They are saying that right now. So if you are doing something right, I've said this many times, okay? It is so easy, so straightforward that Mayegun doesn't. Okay, let me say this. Let me put it this way. When Soweku, the governor point and kill of Lagos at the gate up, right? When he said they have spent over 100 billion naira on doing that's your Lagos Metro line, blue line, red line, right? And then the moment he actually launched it, I know it's pretty much like not really completed by the way, right? The moment he launched it, everybody saw it. Like you saw it, I saw it. Everyone kind of like saw it. I mean, we saw it move, passengers back and forth. Abi? So whether somebody like you or not, if you do something, right, it will be undeniable. You don't need to say, if you open your eyes, you will see what he's doing. No. You should tell me, health care. See, they say health is wealth. All right. So if you are living in Lagos, you must be able to say, I have seen improved health care. And then, you know what I mean? If you are living in Abuja, you are living in Ekiti, or you are living in Sokoto, or Nasarawa, anywhere you are living in Nigeria. Now, it may not be it should be general, right? But it may not be general, which is something we can kind of spare you. So the point I'm trying to make here is this, right? Every member of Tinubu's illegitimate government, they have this penchant for validation through propaganda, lies. And see, most of what they lie about, these are essential things, crucial sort of, stuff. You want to lie about electricity. Just the other day, one of Tinubu's Tinubu's ministers or Minister of Darkness, Adebayo Penkelemes, he came out and he said, you are now enjoying better electricity in Nigeria. Meanwhile, statistically, no, you are not. Even though you are paying more for darkness today. So a few weeks after he said, you are now enjoying more. In fact, today he said you are enjoying more electricity, your national grid collapsed. In 2025, let me put it backward, right? Between 2024 January and December 2024, your national grid collapsed 16 times. So what did the Minister of Darkness say? He said, well, your infrastructure, your power infrastructure, they are too old now, which simply means for you to enjoy stable electricity in Nigeria, they must change all of your infrastructure, your transmission cables, your transformers, they have to change everything. And according to him, you are going to need more than $70 billion. That's what he said. So how can you be enjoying more electricity now when you are generating lesser than what you were generating 9 years ago? How? Mathematically, it should make sense. So imagine if, factually, right? They are currently generating 20,000 megawatts of electricity, distributing 15,000 of that. So if somebody now says you are enjoying more electricity right now, say factually, it may be true. Rather than just say it, just say it into existence, maybe it will come to pass. No. Wishes don't run or fix a country. Wishes. Let's just wish that. So you get. I wish there is 24 hours electricity in Nigeria. But I wishes will not give you 24 hours electricity. Similarly, healthcare. You have been hearing about NHIS in Nigeria. It's called National Health Insurance Scheme. Is filled with fraud after fraud. And guess what? 99% of you don't even know what is called NHIS. If you are not if you are not a civil servant in Nigeria. You won't even know anything called NHIS. Well, because majority are too poor to even contribute towards it. No. So if the Minister of Health, Pate, I've been waiting, I've been reading my comments since, so nobody has told me that indeed they visited Nigeria for their health care. This is Pate. This is the guy.